Assalamualaikum dear student. Today I am going to talk about the atlas vertebrae. Here you can see this vertebrae is called the atlas vertebrae. It is so called atlas because it supports the skull from the inferior. Therefore it is called the atlas vertebrae. So I am going to talk about the anatomy of the atlas. So here you can see the atlas vertebrae have two arches. One is the anterior arch. This is the anterior arch. The anterior arch is short and less curved. And here you can see this is called posterior arch of the atlas vertebrae. It is long and it is curved. And these are called lateral masses. Lateral masses of the atlas vertebrae. And on the lateral masses there are articular facet. Here you can see this is called a superior articular facet, and this is called inferior articular facet. So these are called transverse processes. Here you can see these are called transverse processes, and there are foramen, two foramen in each transverse process. These foramen are called foramen transversarium. On the anterior arch there is tubercle. Here you can see this tubercle is called anterior tubercle, which gives attachment to the anterior longitudinal ligament. And on the posterior of the anterior there is a facet. Here you can see, which actually articulate with the odontoid process of the axis. Here you can see, and it permit the rotatory movement of the skull on the odontoid process. Here you can see, and it form a joint which is called a
median atlantoaxial joint.
And the posterior arch, here you can see this is called a posterior arch. It has a tubercle. This tubercle is called a posterior tubercle, and it gives attachment to the ligamentum nuchae. And there is a groove. Here you can see this groove on the behind the superior articular facet. This groove is for the third part of the vertebral artery. So the superior articular facet is articulated with occipital condyle of the skull. Here you can see these are articulated here and form a joint which is called atlanto-occipital joint. And the upper ridge of the anterior arch gives attachment to the anterior atlanto-occipital membrane. Here you can see there is a gap. There is a gap formation between these two bones. Here you can see this gap is filled by the anterior atlanto-occipital membrane. And on the posterior arch there is also a superior border which actually gives attachment to the posterior atlanto-occipital membrane, which actually fill the gap between the skull and the atlas vertebrae. So this was all about the atlas vertebrae. So thanks for watching the video.